Can you guys see?
Mm-hmm.
Yeah. All right, cool.
Yeah.
All right. So welcome everybody. This is the last seminar, seminar 6 presentation, which focused on positive punishment. These are the table of contents that I will be going through today. As you can see, I will be asking you guys a few discussion questions, as well as a few recaps of concepts and stuff like that that we had to know and terms to remember. I also have a participant activity for us to hopefully partake in, as well as an article recap of the article that we were supposed to read. Okay, first of all, my first discussion question is in regards to positive punishment. So does anybody recall about learning positive punishment during the early semesters in the BHS program? If so, have you had any firsthand experiences with it and why? Anyone? Mm,
Yes,
Well,
I
I do
did. Oh, sorry.
remember.
just go ahead. Yeah.
Go ahead, Nat.
So I do remember learning about it, um, but to have first experience, I don't think so.
Anybody else?
Oh, me neither. No experience about.
Hmm.
Yes,
Oh
I
yeah?
did. I did lots of timeout.
Yeah, timeouts. I was gonna say, what
Yeah,
about
because as
timeout?
a kindergarten teacher, yeah, back home. Oh, yes. That
Oh,
was,
okay.
yeah. I use that a lot. Timeout. So there's my experiences. Of course, when kids were being um not compliant or you know.
Yeah, I know what you mean.
Yes.
At my co-op, I help deal with kindergarten kids and stuff like that.
Mm-hmm.
Yeah, that's interesting.
That's
The
experience.
professor, she was telling that I think she doesn't use timeout with the kids. And I have one kid and I don't know, I don't use as well, you know.
Hmm.
I think sometimes it's necessary, but uh, I, I use other things with her that works. I think depend a lot of the kid, right?
Yeah, for sure. It depends on the kid, stuff like that. I think for me, like if I did something bad, my parents would give me like a chore or something like that for me to do. Like if I made a mess in the kitchen, they would make me like wash the dishes or something like that, so I never have to do it again, I guess. Okay, so those are all good answers, but positive punishment. Oh no, positive punishment is the process of adding an aversive stimulus following a behavior to decrease an unwanted behavior. Some examples of positive punishment included assigning chores to somebody misbehaving, a driver receiving a speeding ticket, yelling at a child for misbehaving, an employee having to sit through an ethics seminar after harassing somebody at work. These are all examples of adding an aversive stimulus to decrease an unwanted behavior. So before I get into the article, here are a few important terms that we might want to recall before I talk about it. One is operant behavior, behavior controlled by its consequences. Self-injurious behavior, or SIB. Another one was positive punishment, of course. Another one was differential reinforcement of other behavior, and extinction and sensory extinction. Okay, so the article recap, intro. So the article was titled, quote, Treating Operant Vomiting with Visual Screening by Baker et al. The article focuses on the problem behavior of operant vomiting, also known as positively reinforced puking. The article also mentioned how operant vomiting is one of the most severe forms of self-injurious behavior, or SIB. The behavior may result in malnutrition, dehydration, tooth decay, and the possibility of death. This can also make it hard for people to care for individuals performing this problem behavior. Okay. operant vomiting behavior definition. So, the article defined the behavior as any instance where, quote, any food or liquid being forced out of the mouth in the absence of recent food ingestion, end quote. The article also noted that the behavior was less likely to occur in preferred environments. Likewise, vomiting was shown to persist in the absence of social consequences during consecutive no interaction sessions. So, case details and client backgrounds. The client in the study was an 8-year-old boy named Max, who was diagnosed with autism spectrum disorder, or ASD. He has a history of attention and escape maintained behaviors, as well as automatically reinforced behaviors. He engages in the problem behavior of operant vomiting, which gives him a history of esophagitis, stomach ulcers, and tooth decay. Client background continued. So, several months before the study took place, Max was implemented into an early intervention treatment program, but due to the severity of his vomiting and other problem behaviors, he was discharged. Also, a medical evaluation was conducted on him, and it did not reveal any physical or biological causes for his behavior. It was suggested that the vomit itself was a stimulus for the behavior. So, comparison of two different treatments. The article compared different treatments together. One was positive punishment, while the other was a form of sensory extinction. The positive punishment procedure involved making the individual performing the behavior use mouthwash and have a caregiver brush their teeth for 5 to 10 seconds. Following that, the caregiver wouldn't provide any attention following 1 minute after the behavior occurrence. The other treatment method was called visual screening, or VS, which is a form of sensory extinction that involves covering an individual's eyes with their hand or a thin cloth for 30 seconds following the behavior. Treatment details. So, the baseline data was collected for 46 weeks. The VS procedure was only conducted at home due to Max's school considering it positive punishment. Both treatment methods were applied to Max. The positive punishment method, aka contingent mouthwash, was applied first and was in effect for 11 weeks, while the visual screening VS method was in effect for 24 weeks. For the VS procedure, caretakers had to hold Max's hands together as well as covering his eyes to avoid Max from blocking the visual screening. As you can see, this is the results of the study. It showed that when the positive punishment procedure was in effect, it demonstrated high variability, and the contingent screening, the visual screening procedure showed lower frequencies of occurrence. So the results of the study showed that the contingent mouthwash procedure wasn't effective at reducing the problem behavior, only reducing it temporarily. Positive punishment method showed high variability, and the results showed that the VS procedure was very successful in reducing the problem behavior. The extinction procedure demonstrated more stable and produced better results. Follow-up sessions. Follow-up sessions recorded Max's vomiting data 1 to 2 and 4 months after the treatment. The results produced 0 to near 0 levels of occurrence of the behavior. Conclusion. The article concludes that the VS procedure's effectiveness was, quote, attributed to the extinction of the sensory consequences, i.e. visual stimulation, that Max produced by vomiting, end quote, implying that the vomiting was a visual stimulant that was reinforcing the behavior, which resulted in the VS procedure withholding the reinforcement, kind of making it a form of extinction, not a form of positive punishment, thus affecting the effectiveness of positive punishment. Okay, so my next discussion question was in regards to the visual screening procedures. What are your thoughts on positive punishment after this presentation? And do you feel that the VS procedure could be considered as a mix of both sensory extinction and positive punishment? Anybody?
Uh, so I didn't see they don't mention actually in this article. First, this article is very interesting. It is in I
Yeah.
think it's one of the most I'll say difficult challenge, right?
Yeah, it's a very hard
It's
article.
very serious. Yeah, I think it's
Yeah.
for the compared with the other ones is the most
Yeah.
serious one. So and I didn't see they don't mention in this article if they about other they didn't try to find other possibility, right? And why the boy he was having the vomit, for example, they didn't try to find identify what kind of sensation the behavior
Yeah,
produced.
yeah. It's interesting because I
So
don't think
visual, taste, yeah, and
it never
so
really explained it, but that's what it said. So I based it off of that.
yeah. So what you ask about, I think that maybe it's or if you think too, they have other options they can use instead to the punishment, no, the positive punishment. Like they could offer like other activities, like intense visual stimuli, like bubbles or sensor or something more sensory, like liquid glitter, things like that. So I think this is article this study didn't should show make study more
Yeah.
before, yeah, but yeah, it's a very hard situation. When I read, say, I never imagined like situation like that.
Yeah, for sure. I don't know. Because for me, I like to my understanding, it seemed like they only ever tested out like these two procedures, right? And
Hmm.
honestly, the reason why I asked this question is because I was actually kind of conflicted because the visual screening procedure, it could have been considered as, I guess, in a way, positive punishment as a way because even though they didn't, and they never said it in the article, I think the procedure of like blocking it, as Christine just said in class. So if you recall, I think when he vomited, like they would have to like cover his eyes or something like that, and then hold his
Yeah, because they
like
have to hold the hands too.
yeah, so he doesn't like take his hand off the eyes, right?
Yeah, they
Which
have
I
to hold.
guess
Yeah,
in a
that's the
way,
thing.
somebody could argue that that procedure itself is a form of positive punishment. As
I
like I guess
agree.
because
I
it could make
agree.
him not want to perform the behavior. But the article did mention that it was in the purpose of withholding the visual stimulus as a reinforcement for him,
Hmm.
which is why I kind of asked, like, do you feel that the VS procedure could have been a mix of both?
I would say like before reading this article, I the thoughts of like positive, just punishment in general, it
Yeah,
seemed like very aversive to me. But in this case, it's a health threatening self-injurious behavior
yeah,
where every like I've read like other things were tried and then they were stopped because of the vomiting and the challenging behavior.
yeah.
So then they resulted in this punishment, the positive punishment. However, I would say that like in the study, it like it doesn't it needs to go more into details about how to replace that behavior, like give an alternative behavior for it because it comes back. Like as they mentioned, it's coming back every 2 to 3 weeks and then it like spiking for 2 to 3 days a couple of times a day. So I would say like one of the biggest limitation of the study was the fact that they didn't try to find another stimuli or behavior to replace the one that the sensory
That's agree.
uh,
Yeah.
thing that he was feeling. So it to me it feels like the study was kind of just done and there weren't a lot of different specific things that would put into it. Like there wasn't any like IOA agreements.
Yeah,
The procedure wasn't done through like school time. So those all of those things like do contribute to maybe why it's coming back and respiking.
yeah, that's true. That's a good point.
I
Um,
agree with Naz.
but
Yeah, because sorry,
no, it's okay. Go ahead.
because it seems as like they focused more because it was an attention escape maintain behavior. And they did not focus on the sensory active. It was also an automatic, I would
Yeah,
say maintain behavior because he was being stimulated. So I agree that that's one of the limitations they should,
for
they,
sure.
yeah,
I
they
get
need
that.
to do more research on that sensory component of the behavior. And I also agree that the VS could be considered a form of positive punishment because you're
Yeah,
adding these actions, you're adding these things. So ultimately, the aim was to decrease the behavior.
which
So
is
that's it. Mhm.
I will say though that I do think that maybe the reason why they didn't look into other methods more was I guess because it was a SIB. So maybe that's why. So I guess they had a sense of urgency and like he had like a lot of issues like stomach ulcers and stuff like that. So maybe that's why they also maybe rushed it, I guess, a little bit.
Yeah.
Okay. Then my last discussion question is the use of positive punishment. After learning about the article, do you feel like you would use positive punishment when you personally are in the field of ABA?
Um, I personally feel like I wouldn't. Like, I feel like sometimes it is beneficial to like different behaviors, but most of the time I feel like positive reinforcement works. Like, I kind of think positive punishment, like, I feel like it really does depend on the behavior. I'm not gonna say I would never use it, but I don't think it'd be like my first option. I think I would go through every other option before I started with positive
Yeah,
punishment.
yeah,
Because, like, I don't know, maybe, like, because of the way they put it in the study, like, I just didn't feel like it was, like, it didn't work that well toward, like, that's just me. But I don't see myself really. Also, too, I feel like it's a lot harder, too, to, like, put positive punishment, especially with all, like, kind of, like, red tape around what you can do. Like, you don't want to overstep, and
yeah,
you're also not the child's parents. Like, you also have to have a really big discussion with them on, like, hey, this is what I'm trying to use. And they also really have to try to implement this at home. And I feel like positive punishment is very hard to implement at home. And yeah, so I wouldn't use it first.
yeah, for sure. I understand what you mean by that.
I would say to adding to what Kyle said, like I would only use it where like every other option has been exhausted and it's a like behavior like this one, like vomiting, like maybe scratching to a point where they're bleeding, like all these like self-injurious behaviors that can cause physical harm to themselves or maybe to others, then that where the positive punishment would come from. But I would 100% before implementing anything, check with the parents to see what they're okay with and what they're not okay with.
Yeah. I also want to say you're doing a great job. I have a doctor's appointment, so I have to go, but great job. And I learned a
Thank
lot.
you. Thank you. No
Bye.
worries. I gotta bounce too soon after this.
Yeah,
All
for
right.
me, yeah.
Oh yeah, go ahead.
Okay, bye, Kat. Yes, for me, I can see myself implementing positive punishment, but it depends. Like Nas said, it would be like the last resort. But when I think of reprimands, like I find myself doing a lot of reprimands, like saying, stop that, or
Yeah,
especially if you see the child is engaging in like aggressive behaviors, you know, like towards, let's say towards me, like the child is coming to bite me or, stuff
yeah.
like that. My initial reaction, I would want to say, stop it, or, no, don't do that, So maybe it can
Yeah.
happen,
Yeah, for
automatically.
sure. Yeah, that's actually a good example of how I
Yes.
guess I would
So
use that
I would see
kind of thing.
myself doing that.
I was actually going to
Yeah,
say that there's a reason why it's like the least used I think I read it somewhere. It's the least used behavioral intervention
I think like I agree with the other girl says for me, I think I can use in some point, but gonna be the last options, it's the last really when I don't have the other options really doesn't work. Didn't work, so that's why the moment that I could use the positive punishment.
Okay, yeah, cool.
I would say to like the reprimand talk that we like that just happened. In my placement, instead of saying like no or don't do this, like if someone asks for like an iPad, we say iPad is unavailable, or they want something, say okay, lunch is unavailable right now, instead of saying like no or don't, or like giving something else to do. So if they ask for something, oh, like this is unavailable right now, but you can try this instead. And like that's something that I've realized a lot of people there do, so they can like not do the positive
Yeah.
punishment as a reprimand. So that's something I realized, which was interesting.
All right, cool.
Yeah,
Yeah, those are good
interesting.
answers. Okay, so the Kahoot time. That was my activity for you guys. Let me just pull it up. Please pull out your phones. You guys can see the screen still, right? Yeah. All right, cool. Cool. I'll put it on this side. Cool. I think that's everybody, right? Yeah. Yeah. Okay. Seminar 6 article Kahoot.
I like this background of this Kahoot.
Yeah, it's nice. What was the main topic of the seminar? Yeah, that was kind of easy. Positive punishment. Okay. Next question is, who was the participant in the study? Yeah. Okay. Yeah, the guy's name was Max, right? What were the two procedures introduced in the study? Uh, what?
I pressed the wrong one. I didn't read the whole thing.
Who pressed green? Was that you?
I did. I did.
All right, all right. Who pressed blue? I guess that was a trick one though. All
Oh,
right.
I'm not seeing just second. Okay. I don't
Oh,
know. I'm
sorry.
not
Yeah.
seeing
It's
the. No,
red,
that's okay. It's not
right?
your fault. It's my fault here.
All right,
Let me
okay. I'm
close
gonna move on. I'm gonna
this.
move on. Okay. What was the problem behavior?
Oh, just
Oh, who clicked vomiting? All right, okay. Okay.
Okay, that's a catchy one.
Yeah, I know. I'm trying to
It's
trick you guys.
green, right?
I put a lot of thought into these questions.
Damn.
All right. The next quiz was, what were the results of contingent mouthwashing? Yeah, it showed really not effective, only temporarily. Okay. Visual screening wasn't effective at reducing the problem behavior. True or false?
Oh, visual screening wasn't.
All right. Yeah. Okay. Aberrant vomiting was a severe form of what?
I think
All right. Who said health risks? All right, nobody. Cool. Cool. Okay. All right, we're almost at the end. Baseline data was collected for 46 weeks.
Don't remember that.
I can't remember this. I just guessed. Hopefully
What?
correct.
Yeah, I think it was.
Yeah, it was true. Yeah.
How long was it collected for?
For
46 weeks. It was collected for 46 weeks.
Yeah,
And
I
then
remember that in 23 weeks when they start for
it was
with the
11
punishment,
weeks for
right?
the contingent mouthwash, and then it was 46 weeks for the VS.
Yeah, 43 or 46. Yeah.
Yeah.
So long, that's caught my attention. Oh my gosh, it was totally 1 year and something.
All right. Okay, second last question. Which was it? The visual screening procedure was applied to both Max's house and the school. Yeah, that
oh,
was false. If you recall, they only said the school said no because they thought it was like a form of punishment, so
Yeah.
they didn't want to apply it. All right, good job. Last question. When were the follow-up sessions recorded?
This, I don't know. I don't remember.
Okay, just guess, just guess. All right. Cool. Okay. Podium.
Oh,
Yay.
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 Yay. Bingo.
We're
Congratulations.
glad.
Congrats, congrats.
Congratulations.
Good stuff.
You had lots of questions there. That's good activity. Yeah.
Well, trying to just exit.
Did your Kahoot just change this background or did you change it
I
yourself?
changed it myself. Yeah.
Okay, okay,
I
okay.
used they had like this fall like seasonal setting as the
Yeah.
background, so that's what I used. I chose spring because it's
Oh, cool.
yeah.
Nice. Great
Okay,
job, Jaden.
thank you.
You're watching your time.
I know. Oh my
Sorry.
God. I thought it'd be faster, but we're at 30 minutes almost. Okay, closing thoughts. The use of the VS procedure has left me with conflicting thoughts regarding the use of positive punishment for intervention procedures. While it may be effective for an immediate behavioral change, it is crucial to consider the long-term consequences, which is why it would be more important to find a way to eliminate a behavior or reinforce alternative ones, especially regarding self-injurious behaviors. That is my
Great.
reference.
Mm-hmm.
And thank you for listening.
Thank you.